Okay, in this video, I'm going to be breaking down the hamstring graft, going over some of the major points where pros and cons, indications, and also some potential complications that can occur. Okay, in this video, I'm going to be breaking down the hamstring graft, going over some of the major points where pros and cons, indications, and also some potential complications that can occur. I will be utilizing a research article from the Journal of American Academy of Orthopedic Surgeons. The article is entitled Graft Selection in Contemporary Anterior Cruciate Ligament Reconstructions by Rafael Barrera. Sorry if I butchered that last name at all. And again, I'll link that below. So again, looking at the four major considerations or four major points for a hamstring graft. And I will be also kind of sharing maybe some personal indication or personal anecdotes just based on experience as well. So indications are, again, sort of based on experience, and also the study is young athletic individuals who are skeletally immature or mature. So these are potentially patients who are like, maybe 12, 13, 14 years old, who their growth plates are still open, so they can't use patella tendon graft. Also, I would add in that you may be looking more towards adult population, people who are in their 30s and 40s who are still really active, but not necessarily looking to go back into super aggressive level sports. Another indication that sports that don't rely heavily on the hamstring. Again, that's based on the research article. They gave an example of sprinters. I would say that this is the graft that I probably see the least of, in addition to cadaver, just based on a demographic that I work with. I think hamstring graft has a lot of negatives associated with it, which we'll go over in a second. But just a hamstring graft is just not one that I really see. I don't think I've seen one in at least over 2 years or so. And the only one I've seen was due to a re-tear that they had, so they chose the hamstring graft after that. Next, we're going to go over complications. What they listed as donor site morbidity or knee flexion weakness. That obviously makes sense because you're weakening the hamstring. Compromise of the medial knee structures, higher re-rupture rates than other grafts, and they had listed a 17.5% re-tear rate for hamstring grafts versus 6.4% for patella tendon grafts. Longer graft integration times, what they listed as between 8 to 12 weeks. And a slightly higher infection rate, they listed as 0.6% for hamstring graft versus 0.07% for patella tendon grafts. Some of the pros are it's an option for the skeletally mature or the immature. Maintenance of the integrity of the extensor mechanism, meaning that the patella tendon or the quad tendon are essentially untouched. Greater cross-sectional area than patella tendon grafts, 53 millimeters versus 35. Lower harvest site morbidity, smaller incision, because most of the time they're not touching the front of the knee, so you don't really have to deal with that. Less post-operative pain than patella tendon grafts, and what they listed as 11.5% for hamstrings versus 17.4% who do experience post-op pain compared to hamstring versus patella tendon grafts. Some of the cons, the bone tunnel enlargement due to the windshield wiper effect, and then residual hamstring weakness, which is obviously the biggest con from a hamstring graft. I will say I personally really advise people, especially younger athletes, to really push away from this graft. They're just that residual weakness is, I would say, something that can linger for a very, very long time, and patients can be over a year out and still have residual hamstring weakness. From my experience, a lot of times, and I've posted videos about this before, is that a hamstring graft, when they flex, especially, they can be 6, 7, 8 months out, and they'll do just an active knee flexion. Their knee will typically stop at 9 degrees. Again, that's just due to, obviously, them taking a piece of that hamstring to use as a graft. So that means that from that 90 to, let's just say, 110, 120 degrees, they actively cannot even get there. So the way I explain it is that, when you go to the gym and you do a bicep curl, typically you'll go all the way down, all the way up for the most part. And for the hamstring, if you can only strengthen from 0 to 90, does that hamstring ever fully get back to at least, again, near 100% strength? And I would argue the answer is no. Because again, if you're missing a good chunk of that range of motion, even if it's, let's say, in prone, they can bend to 120, you're only strengthening through 75% of the range if you can only get to 90 degrees. Another thing is that hamstring grafts will compensate when they're doing hamstring exercises. And unless you're really paying attention to it, it can be missed out on, because we know for the most part, they're taking from the semitendinosus. And since that's on the inside of the knee, patients will typically want to externally rotate their foot when they're doing especially single leg hamstring exercises. So ball curls, feet heel elevated bridges. A lot of times you'll notice that they're even a prone hamstring curl, you'll notice that they want to actually rotate their foot, because again, the body is just trying to figure out a way to make these exercises easier. So by externally rotating the foot, they're taking pressure off of that semitendinosus. So just cues that we want to make sure that we are aware of. And for that weakness, something that I again, is maybe odd, but I have stimmed the hamstrings before. Again, the way I view it is after surgery, whether patella or quad graft and even hamstring graft, you're stimming the quads to try and stimulate it and wake it up. So it should be no different for a hamstring graft. If you're taking away from the hamstring and significantly weakening the hamstrings, stim it to help wake it up. And I remember so vividly the first time I tried this, I saw a girl who was like 5-6 months post-op. She was like, I never feel my hamstrings. I just never really feel it working. I stimmed her hamstrings, and I just had her doing a standing hamstring curl with, I think, a 5-pound ankle weight. And again, she was pretty far out. And I vividly remember she texted me the next day and was like, I cannot feel my hamstrings. This is the sorest it's been since surgery. Just a way of just again, helping her get to more active ranges for her hamstrings so we can strengthen it. So again, that's just sort of a quick breakdown of the hamstring graft, the pros and the cons, considerations, and complications that you may see. Again, personally, it's not a graft I recommend typically, maybe for someone who's 30 and over, 25 and over, active adult type of thing. But not someone that I recommend for an adolescent population. So hopefully you guys find this video helpful. Thank you for watching today's video. Please feel free to like and subscribe. I have started an ACL Master Man Group, which is a program designed for physical therapists, physios, strength coaches, students, and athletic trainers who want to learn more about ACL rehab. It currently holds over 600 videos and has over 500 members, with new videos added every single month. The videos cover immediate post-op to late stage sports-specific movements and everything in between. Content specifically also includes rehab complications, treatment philosophies, case studies where you can see my real-life patients, movement assessments, exercise breakdowns so you understand how to properly teach the exercises. The exercises are also arranged by difficulty level for strengthening exercises, plyometrics, balance, and neuromuscular control. Of course, it also covers late stage for movement exercises from structured all the way to randomized and chaotic to mimic more sports-related settings. And lastly, you also learn how to do return to sport testing, which is extremely important, and this what ultimately determines whether or not someone is safe or not safe to return to sports again. There's also questions within the group where you can learn how I engage with patients and their parents of how to answer difficult questions throughout the rehab process, which is inevitable to come up. And lastly, you gain access to a private forum where you can ask questions directly to me and others within the community. We share research articles, we share other equipment and beneficial equipment and things like that. Anything that can come up within the ACL rehab spectrum, that's when you can ask within the private forum. And lastly, you can also download the app where you can gain access in your respective facilities directly on your phones. If you have any interest, please feel free to click the link below, and I appreciate you watching today's video.